3, 2, 1. Smile. Hi, my name is Dr. Fifi Yankson, and it's another session with your dentist. Today we're going to talk about gum diseases. Gum diseases. I'm sure there have been episodes where you have brushed your teeth and you've seen blood coming around your gums, the pinkish part, that's what we call the gums. And I'm sure you've seen all those yellowish nice layers that are tinted around your teeth. Yes, where you just had a look at all those yellowish stuff. That's called calculus. And guess what? They're not supposed to be permanent residents in your mouth. What happens? These things contain bacteria, and what this bacteria does is that it actually breaks down the supporting structures of the tooth, and then with time that tooth becomes shaky in the socket. And then with time, if not treated, your tooth will just be sitting there and then it will pop off. That's your tooth that has been lost. So this is what gum disease literally is about. What happens is that there's bacterial breakdown of the tooth supporting structures, and then if not checked, you end up losing these supporting structures, and then your tooth can actually fall out. So if you've noticed any of these yellowish stuff in your mouth, then what that means is that you have a lot of bacteria residing around these tissues in your mouth, and they can cause loss of your teeth and loss of the tissues. I am sure for some you have seen the fact that sometimes the pink gum around your teeth kind of are lowered away from the tooth, and then for some you start seeing the root surfaces of your teeth. All these are components of gum diseases. The main factor is, yes, this plaque and calculus, as we call it. And please note, your toothbrush at home can't get it off for you. That is the reason why you need to see your dentist to get rid of all those yellowish stuff that are not permanent residents in your mouth, so that you can debulk the bacteria in your mouth and you can protect these supporting structures and keep your teeth strong and stayed till it carries you to the afterlife. So if you are there, and yes, I know you're checking the mirror right now and you see any of these yellowish stuff, please, you need to rush to your dentist, get them cleaned, and then let's start taking care of your teeth and your gums as it ought to, so that we can avoid gum diseases of all forms, and we can help protect your teeth and keep them in place without them getting mobile.